Good morning. So I want everybody to imagine themselves that we could possibly be in Winnipeg. We could possibly be in Vancouver. We're in a coffee shop, and this coffee shop is mainly for optometrists and pharmacists who get to sit and talk and go back and forth. I'm Dr. Luke Small. I've been practicing for over 20 years in Winnipeg, Manitoba. And today I'm joined by Miguel Lopez D. Miguel, how are you?
I'm good, thanks, Luke. How are you?
Great, thank you. So we got a bunch of flies on our walls today, listening to our little conversation about practical guidance for medical management of glaucoma. And as we're both well aware, um, there's a lot of questions when it comes to glaucoma, just for many reasons, for many patients, and even for pharmacists and hopefully some optometrists who are listening too.
Well, thanks for opening up our discussion on this coffee chat that we're having today, Luke. As I've been introduced, my name is Miguel Lopez D. I'm a community pharmacist and pharmacy owner. I've been practicing pharmacy for over 20 years. And, certainly when we talk about glaucoma, it's an asymptomatic condition until there's substantial irreversible damage to the optic nerve fibers. In fact, it's estimated that up to 50% of people with glaucoma are not aware they have the disease. So, can you tell us about a few of the strategies that optometrists use to implement to promote an earlier diagnosis of glaucoma?
Absolutely. I mean, it's a great question, and I think it's one of those things of when general practitioners and other people in the medical world ask us why are we looking at the eye so often? Because for just about everybody over 65, we often will recommend, well, we do recommend that we see them annually, and that often surprises patients. And so often patients will say, "Well, I don't have glaucoma." Well, there's no way, and I always kind of chuckle to myself because there's absolutely no way for them to know whether they have this disease or not. And the issue is that because this disease can slowly progress and damage things and start to steal away vision way before they have any idea that it's there. It is often known in our circles as the silent thief of sight, and I think that's a great way, and I have to mention that to patients to say this can steal away a lot of your peripheral vision slowly without you even knowing it. And it takes our specific specialized instruments to pick some of this disease up early. And if we can find it early, and then the biggest thing is we can start to treat that early before there's any sort of damage that we can't repair. I think it's really key. If someone comes in to me and says, "Hey, I feel like I've lost a lot of vision down in this corner or peripherally somewhere," that disease is so far advanced that we've really missed our opportunity. We're not going to get that back. So I think that's just so key to let all our patients know that these annual exams and verifying and doing these sometimes extra tests are really important to preserving their eyes for the rest of their lifetime.
Well, thanks for sharing that insight. I mean, certainly that image of the silent thief of sight is a very striking one. And, it's concerning to imagine that, the disease can progress to a state where it's difficult to undo what's already been done. So that really underscores the importance of annual exams and the things that you've mentioned. So I'm going to switch over to prescribing and ask you, what are some of the key variables that you consider when you're prescribing topical medications for glaucoma?
Yeah, that more great questions because one of the things we're looking at first, and as every optometrist has been very well aware, because we've had so much of this within our own continuing education, we look towards dry eye disease. I mean, that's one of the first things that we'll look if this patient already has that, and we're going to be starting them on a medication that we're asking them to put on their eye at least once a day, potentially multiple times a day. And obviously, there's some preservatives that potentially are in these. We've got some choices there. So this comorbidity of already having dry eye disease, we would definitely look at that. Absolutely. The other big one that I've learned through the process of doing some of this recent education is really looking at systemic hypertension. And we'll get into this a little bit later, but that's where the communication with the pharmacist becomes so important, and that knowing what are they already taking in terms of medications. What comes to my mind right away are those beta blockers. If I'm going to be giving them another beta blocker and they're already on a systemic beta blocker, even though through their ocular system they're not going to be absorbing a ton, it's still enough that it could definitely give them some side effects. So again, there's that communication with the pharmacist. And the other thing is we look at adherence and compliance. So how many drops per day are they going to need to take? And I remember when I first graduated, I had lots of patients that would be on sometimes 3 different medications, sometimes 4 or 5 times a day. Oh, I got to take these at lunch. I got to take them in the morning. I got to take them before I go to bed. How am I going to remember? And absolutely compliance goes down. We all know that. That goes for probably any medications that are out there. And that's, I'm sure for pharmacists, they're more aware of it than we are. But we're really trying to find the best medication with the least amount of drops that that patient needs to take so that they stick to the program. So that really comes in, I guess it's a question back at you that when you're counseling these patients who are filling this prescription that we've written for these eye drops and say it's the very first time that they're getting these, what are the key counseling points that you'd make sure to review?
Thanks for the question, Luke. Certainly there's a lot of things that we have to go over with patients, especially for new medication. Um, Pharmacists are guided by regulations from the Health Professions Act. So when you first receive a medication, the pharmacist will often go over the following things with you. Initially, we'll talk about the name, the strength, the purpose or effect of the medication. And then we'll go into the directions for use. So in the case of eye drops, we'll be talking to the patient and possibly demonstrating, how to properly instill the drop without touching the eye. We'd be discussing when they have to instill the medication. So what time of day or multiple times if it's dosed more frequently than just daily. We'd also be talking about how to deal with missed doses if they forget to take their dose. And then we would be addressing potential adverse reactions and how to manage them, how patients would monitor response to therapy, storage of the medication, how long the bottle would last, refill information, other drug specific or patient specific considerations, when to seek medical attention, and when to go back to the optometrist for follow up. As you just heard, there's a lot of information that we have to share with patients. So, feedback and understanding is really important so we can implement or use various tools to support counseling as well. We can provide them with written information to jog their memory, guides and pamphlets, and even recommend an installation aid if it's appropriate. And then, just as a final thought on this, it's important to remember that the initial conversation with the pharmacist is not the only conversation they're going to have with us. Patient care being an ongoing thing, future follow ups for questions, addressing adherence, and so on, those are all very much a part of what we do.
Yeah, I love to hear all those points because it makes sense to me that that patient is going to be seeing you guys a lot more often than they're seeing us. And I think again, communicating with us to say, hey, on this renewal, um, yeah, I love to see certain check boxes or little notes back to me. And for at least in Winnipeg, we're often faxing back and forth. Things like, that, hey, this patient is due to see me. I haven't seen them in in a year. And that happens. Sometimes it's even longer than that. And oftentimes, especially once we've started the medications, we might be seeing them every 4 to 6 months, 3 to 6 months. So that's where you guys can help us with those reminders. The other one point that you popped out or jumped out at me was, instilling these drops. Recently, I saw a video that a glaucoma specialist put out in regards to it was a study where they asked the patient to show them how they put their glaucoma medication in, and it is incredible how wrong they can do it. Smashing the dropper into the eye and flipping the lids over and dump all sorts of crazy ways that they do it. So that really hit home for me that proper education on how to do that. So we really look to you guys. Obviously, we're trying to review it, but it definitely helps coming from you. So I think all of those things are great, and I think it's important for the optometrist to know that the pharmacist is discussing those things and that they're going to help us manage this patient. Obviously, we've also got some barriers that come up here in terms of compliance and adherence. How do you approach that when you're really trying to get a patient to understand and maintain with their regime that we've prescribed this medication at a certain amount of time and how often they should be taking it? How do you counsel the patient on that?
Yeah, that's a great lead in into the discussion of patient adherence. Patient adherence is a key component in the whole concept of ongoing care and disease management. And pharmacists play a critical role here in supporting patients to ensure that they derive the most benefit from their medications. First and foremost, I think it's important that we identify the reasons for non adherence. Some of the most common ones we hear pertain to things like difficulty in administering the medications. You talked about that video about how challenging it can be to administer eye drops and all sorts of the techniques employed. I don't know if technique is the right word when you're smacking an eye drop into your eye. I'd probably blink. I mean, I don't know how these guys keep their eyes open sometimes as they're approaching their eye with this pointed object. But that can be a barrier. The high frequency of administration is a big one too. When you're asking patients to use three different medications, and you're doing this every few hours, it just becomes a barrier because you're basically tied to wherever your drops are stored. If you're not out and about in the neighborhood or if you're traveling, you're kind of having to hang on to these drops and work with trying to administer multiple drops during multiple times in a day. So that, in a sense, is kind of like having too many medications, and that is a barrier for adherence. Cost's a big one as well. Some patients will pick and choose and say, well, I don't think I can afford this, or maybe I'll just buy or purchase this one this week and wait until I can afford the other one before I pick it up. Some might even scrimp on their drops. So, for example, if you tell them to use 2 drops per installation, they'll wind up just using one because of the cost. Those are some of the things that we hear from some patients with respect to why they aren't able to take their medication exactly as prescribed.
Recently, I had a patient that she had been using the same prostaglandin drop for a long time, and pressures were quite well controlled, and it was working really well. And then the pharmacist found out that she, instead of replacing it and getting rid of it every month, every 30 days, as she was supposed to, she was using this drop. There was enough there to last her 2 months. So as soon as she switched over to a month, her costs went way up. So then she asked the co-managing ophthalmologist that I co-manage a lot of glaucoma patients with, and myself, is there something else that we can try? And then, unfortunately, the second one we tried, her pressures weren't as well taken care of. So it's interesting, these all these different things. And so often, as an optometrist, we don't know the cost. We're just prescribing based on what we feel would be best for this particular patient, because everyone's a little bit different. So that's where we look to you guys. So I love to hear those points about trying to keep people compliant, because it's always an ongoing battle for sure.
Yeah, that's a great example. And, certainly like you've already done, um, once a barrier has been identified, the approach to address each particular barrier will vary. And then the process does enter into this cycle where the patient is given information, they're given tools, offered knowledge and support to address the cause. And then, down the road, then you follow up to assess whether that technique or that future adherence has improved.
Yeah, and I think that leads into further questions that I have in terms of, you know, how do you enhance this collaboration? I think if obviously, you and I are working down the street from one another, that's a pretty easy discussion, and say, hey, go talk to Miguel about this because I need you to look into like those kind of things. But oftentimes, at least for me, the pharmacist is way across town. I might not obviously be familiar with them. So again, what are some of the ways that you would look at that would increase the collaboration and enhance collaboration? What do you foresee that would be good?
That's a great question. I'll preface my answer first by saying that in this day and age of email and texts and computers and this amazing technology we have, one of my favorite tools in the pharmacy is the fax machine. And when you talk about being able to enhance collaboration and discussion with optometrists, let's start with a prescription. When a prescription comes to us with the written orders for the medication to be prescribed, I've begun to see more prescribers indicating diagnosis. And in the case for optometry, I would say if we had a sense of what the drops were being used for or prescribed for, I mean, we'll often suspect what it's being prescribed for, but until you actually write the diagnosis, it's almost a little bit more empowering to help support us in our attempt to support the patient as best as possible. So things like indicating diagnosis, the severity or stage of glaucoma, just sort of an idea roughly of what your therapeutic plan might be that you have for this patient. Those are the type of things, if written on the prescription, are an opportunity for pharmacists to reinforce any messaging that you may actually even have for your patient. Like reminding them of when to come in for a follow up, any sort of assessment or monitoring that they might be able to do. So any of these items that you write becomes part of the patient's record. And we're able to use those bits of information to counsel them more effectively and also pass along any additional messages you may have for them. In return, I mean, some of the things that we might be able to share with you could be some insight into any of the over the counter medications that the patients might be taking. For example, any eye vitamins, any herbal medications that they may be on that they might not just be aware to think to share with you when they're in the office with you. Also, in some cases, because patients see their pharmacists so much more often than other healthcare professionals, they they can get really comfortable, and it's not like a doctor's office or an optometrist's office where it's more of a clinical setting, as opposed to the pharmacy where they might be a bit more comfortable sharing certain things or giving insight into their lifestyle uh, that they're happy to blurt out when they're talking to their pharmacist. So anything that they might discuss with us at that point that is clinically relevant, that might affect their glaucoma or any other disease that they may have, those are some of the things we could relay onto you as prescribers that might assist you in the bigger picture of caring for our mutual patient.
I was going to say I'm always surprised at what they divulge to me, so I can only imagine what they might tell their how comfortable with a comfortable pharmacist for sure.
Yeah, yeah, no, definitely. It's part of the rewarding part of this profession is hearing, getting to know your patients better, building those relationships. One of the other great things I found with this continuing education program is how it discusses the phenomenon of overdippers. And when I think to that, I would guess that there's a fair number of pharmacists that might not even be aware of the issue. And so, having it as part of the educational component here, it's a great opportunity to provide further education to the patient and be part of follow up conversations with the optometrist. What are the sort of things that we can do to support you with respect to the continued care for patients?
I think all of that. And so, again, so often, no matter where we fall in the medical paradigm of that patient's overall healthcare, never mind just their eyes, that we're all a cog in the wheel, and that becomes so important in terms of communication. I'm a third generation optometrist, and if you look at the level of communication, how much that's changed, even since my dad did this, he can't believe that he walked out the door at 5 o'clock every day, and just that's how things were done. Now, my wife, who is also an optometrist, we can be there for 2 hours charting and finishing charts and making sure it's complete, and then making those letters, because we're sending letters to obviously the prescriptions that go to the pharmacist, but I've got letters to obviously ophthalmology, but then neurology and rheumatology and internists and all the everything. So I think again, all of that comes down to communication and letting you guys know, potentially even indication. Like I'm involved with training fourth years for Waterloo, the University of Waterloo, the School of Optometry there, and I try to make sure I always remind them to put the indication. Let the pharmacist know, not just maybe glaucoma. Hey, is this normal tension glaucoma? Is this low tension glaucoma? Was this a closed angle? Those kind of things, as simple as they are, just a quick note on the prescription would, I think, really help you. And I would tell my colleagues to do those kind of things, because it'll only help going back and forth. And as you mentioned, this idea of over dipping, I've really started to ask all my patients and that's a lot of them that have systemic hypertension, that are on medications. My practice is so often, so mainly filled with over 65-year-olds who are on these medications. When are you taking this medication? Because if you're taking it before bed, well, it's very likely that your blood pressure, or I shouldn't say very likely, but your potential for your blood pressure to drop so low that you have poor perfusion, blood perfusion, oxygen perfusion going up to not only your brain, but also to your eyes, and therefore the optic nerve. And we get these patients that will continually get worse, even though we're controlling their IOP, their intraocular pressure, absolutely perfectly. We've got them right on target, some of them as low as we can possibly get them, and they continually get worse. So this idea of their blood pressure dropping, these over dippers, is become really. I'm very aware of it, and any communication I've had with whether it's even cardiology or their GPs, that I've never had somebody say, "No, I want them to take it at night." It's generally fine to take it in the morning. So I agree that this is one of those things that I've learned on this too. So anyway, I think that brings us to the end of this. I want to thank Miguel and everyone involved in this for helping us. And I've done a ton of learning myself, and hopefully everybody listening. It just opens up, it's all about communication and increased collaboration. And what part do we play in making patient care number one? So thank you very much, Miguel. I appreciate having you here today in our little virtual coffee shop.
Yeah, likewise. Thanks, Luke. It was great having a good conversation with you.
Appreciate it. Have a great day.
You as well.